I was unusually excited reading the news feeds that I get every day from all the different journals. There was a great piece, I had hoped, from the American Heart Association about their new dietary guidelines to help, instead of taking drugs or other things to manage your heart, dietary advice. I was excited. I thought, this is great. But their recommendations weren't so great. There were a couple good ones, like eat the rainbow, eat lots of fruits and vegetables. That's great. But then they talked about skim milk, and they talked about how important that is instead of whole milk. And they talked about margarine, which in my opinion that's plastic almost. It's just not good for you. I wouldn't recommend it to anyone, regardless of their status. Butter's much better for you in limited amounts. So when the government makes recommendations about how you should eat, they're going to use the guidelines from the American Heart Association, which don't deal with you personally and individually. Your personal individual needs with regard to your diet should be your choice, and they should be your decision to make, and you should get great guidance about your individual needs. So my generic recommendation to you would be, the American Heart Association guidelines are very limited. You need to talk to somebody who understands diet well and can customize a diet for you, because you're going to do much better avoiding sugar, processed foods, and any kind of margarine type products that are highly saturated fats. And the government isn't going to be able to give you the kind of care that you need and that you can secure for yourself with just a little bit of attention.